So this is a presentation on gout. Now, gout is a metabolic disorder, uh, but most people see it as an arthritis because of the clinical presentation of it. It's a metabolic disorder because it changes blood chemistry uh, due to metabolism. Um, it's it causes acute arthritis that can actually become chronic arthritis, and um, and basically it's um, it's when uric acid crystallizes and deposits in in the joint in the synovial fluid. Now, men get it 10 to 1 over women, and the women that get it tend to be postmenopausal. So, and it's quite common. Um, so, what's happening here? There's too much uric acid, and there's too much uric acid for one of two reasons, or both reasons. There's too much uric acid because you make too much, uh, or there's uric acid levels are high because you're not peeing enough out, or both. So if you're making too much and you're not peeing enough out because the kidneys are compromised, then you are more prone to gout. Now, there are things called pseudo gout. When it's not uric acid, it can be calcium pyrophosphate dihydride crystals. Um, it's interesting because it presents exactly like gout. It actually has kind of the same um, physical manifestations of gout, but it's the wrong crystals. And so these people don't respond to gout medication. Again, this spring, I had somebody present to me at the office with what he said was gout, and this recurrent gout that wasn't responding. And as I investigated it, we kind of determined that it was probably pseudo gout, and there were a few other things that made you think that it could be pseudo gout, um, and his family doctor concurred. Now, I don't know whatever became of him. I treated him for a while, got it under control, uh, but I haven't seen him since he saw the specialist. So I'm going to assume that it was pseudo gout, just because he didn't react to the gout medications properly or as expected. So, what causes uric acid to go up? Uric acid is really from the metabolism of proteins, of alcohol, uh, that kind of thing. A lot of fats will do it. So sudden weight loss, binge drinking, binge eating will do it. Now, in the past, they used to call it the rich man's disease because it happened in people that ate high purine diets, so lots of red meat and red wine and things that the peasantry couldn't really afford to eat so much, but the aristocrats in Europe did eat, and they tended to overeat in those things, and they didn't get a lot of exercise. They tended to have a fair amount of weight, and so gout was considered a problem with them. Now gout is seen more often in the wino population. Um, I really first encountered gout a lot. I was um, When I was in first year, I was assigned uh, an intern in the clinic that I followed and observed. I didn't do any treatments in first year, but I had to spend clinic time with a senior, with a fourth year. Uh, and the senior I was assigned was working at a free clinic at the corner of Wellesley and Jarvis. and which is so all the patients going to the free clinic were either winos or hookers, and it was a an interesting. We saw some reactive arthritis. We saw, and I saw a lot of gout, uh, really kind of bad gout. Uh, so the uric acid accumulates, and when it gets to a certain thing, it starts to crystallize, especially around what's called the tophus. Um, uh, in I don't know if you ever did the science experiment where you hang a little crystal of salt on a thread in salt water and then grow crystals on it, and it's the same sort of thing. That once there is a locus that will start that crystallization, then the crystals spread from there, and they're sharp, and they literally um, start to cut up and cause inflammation by mechanically altering the joint. Now, it happens where the blood flow is the slowest, so the furthest away from the heart that you can go, and coolness causes precipitation of the crystals. So really, the big toe is the place where it normally happens. The onset is usually sudden because what happens is there will be this dissolved uric acid, and then once it starts to crystallize, it causes more crystallization. Uh, and that seems to be a big thing. Now, one of the places that we get rid of this stuff is we combine it with sodium, or it does combine with sodium in the extracellular fluid and starts to deposit is as deposits of sodium urate extracellularly in the interstitial space, and we call these tophi. Uh, and I've actually seen the tophus so so much of this stuff that it was actually pushing through the skin. The crystals were pushing through the guy's skin on his ears and on his nose, and uh, and it was kind of falling off like a crystalline dandruff. The gout was so bad. He had so much uric acid, um, and he was like a living in the park at Jarvis sort of guy, sleeping on park benches, and uh, hadn't bathed in quite some time, and you can just imagine. Um, but I'll never forget it. This is actually a photograph of the uric acid crystals, and you can see they look like little needles, and you can almost imagine what the pain that causes in the joint when that's there. Um, So high purine diets are the big thing. Red meat, organ meats, shellfish, alcohol, asparagus, and think of that like kind of that rich man's diet. Obesity uh, aids in it, but when you start losing weight quickly, high blood pressure uh, will cause it because it starts to cause a stasis. High blood pressure actually starts to back up a little bit and can cause some right-sided venous stasis, which can help manifest this. They people with it get attacks of it rather than one ongoing chronic thing. Now, the it's a sudden onset, and it's extremely painful. My diagnosis prof years ago said that it was that the pain can be described as exquisite. It's perfect pain. Um, it can cause fever, and just from the reaction, a systemic reaction. But mostly, it's just this extreme pain in and around the big toe is the most common place, and it will actually erode away at the joint, and you get this punched out lesion. You can see that right in here, it looks like there's almost a chunk of bone missing, and that's because it's eroded away by these crystals. And you can see that this joint extends all the way out here with the inflammation. Look at this, there's a lesion right in here that is literally punched out as well. So this is a chronic gout case. This is a bad one. Like oftentimes the pictures that you see in pathology textbooks are extreme cases of it. All of this, by the way, is on page 701. And you can see pictures in figure 17-33 of tophi being deposited in under the skin. Some pretty nasty ones. Figure A is a pretty scary looking one here. So, and that's on page 703. Anybody that wants to see what I'm looking at right now. So the gouty attacks seem to come back with increasing frequency and severity, precipitated by trauma, by surgery, by alcohol consumption, by overindulgence with certain foods. And so it seems that this is the way that it goes. So the complications of it are kidney stones and maybe renal failure, because one of the issues is that that the uric acid has to be excreted by the kidneys, and it's crystallizing. It's in high, so it can actually crystallize in the kidneys and form a kidney stone. So these wouldn't be calcium stones, but they would be there. It can cause cardiovascular disease because it can really tear up the inside of blood vessels as well. You diagnose it from the pain. It has to be distinguished from pseudogout, like I said before, for that chemical accuracy, because doing things that will reduce uric acid, if the problem isn't uric acid, if the problem is calcium pyrophosphate dihydrate, then doing things that reduce uric acid are probably not going to help. Every time I read this, and even going way back to like the early 80s when I first was taking this, they talk about aspirated fluid showing the uric acid crystals. And that just blows me away. When you see somebody with gout, they can't wear a shoe, they can't, even the weight of a bed sheet across their toe causes extreme pain. I don't know how much you have to strap them down and what kind of a bullet they have to bite on to have them allow you to stick a needle right into the synovial membrane and draw out synovial fluid so that you can look at it under a microscope, aspirate that fluid. I really can't imagine the amount of pain that test would bring. But whatever, apparently they do it. Maybe they do it under an anesthetic. So how do you treat it? You try and bring down the uric acid. You use anti-inflammatories. Those are the two big things. You use pain relief, but you can't use aspirin, and as far as I know, it's probably not a good idea to use Advil either, because both of them will increase uric acid. So this is a problem of concentration of uric acid, so lots of hydration helps dilute it. Sudden weight loss brings it on, but after the acute has passed, probably trying to get people to slowly lose weight will help. Avoid the purines. Avoid things like spinach and asparagus and red meat and red wine, alcohol in general. At least to moderation on it. Don't binge eat or drink with this. You're way better off kind of managing it in small amounts. Don't ice it. Even though it's an inflammatory thing, a huge issue because the joint is hot and swollen, you first think, well, we should ice it to cool it. And well, icing it actually causes more crystallization of the uric acid, because it becomes less soluble as the synovial fluid becomes cold. So it actually severely worsens it. Um, Probably a local, it's a local contraindication, but you're probably not going to get these people on your table during an acute attack. They don't even want to go out of the house. They don't want to put on a shoe. If it's in their right foot, they can't push a gas pedal. They're probably not showing up for their appointments when it flares up. Um, if they have a history of gout, it's all part of your history taking. Find out about kidney health, because a lot of people with kidney disease will manifest with some gout, but they'll also manifest with blood pressure issues and a number of other issues that you should be aware of as a therapist.